we're going to talk through the Sphenopalatine ganglion block. We'll assume that the pre-procedure checks have been completed, monitoring has been applied, and that the patient has been sprayed in each nostril with either cophenolcaine or otravine, and we've given that some time to work. Meanwhile, we can position the patient on the bed, ideally that will tilt 30 degrees head down, or failing that, with the head hanging off the edge of the bed, as you can see here. What we will then do is insert the mucosal atomization device that has a 30-degree kink on the end. Explaining to the patient that this may be slightly uncomfortable at the time of insertion. And what we're aiming for here is that tip from my position on the patient's left side to be aiming towards the outer corner of the eye, or the superolateral direction. So on the patient's left side here, I'd be aiming to have that tip placed in the 10 o'clock position, gently inserting into the nostril, using as little force as possible, so we don't want to cause any trauma, and inserting backwards until resistance is met. It doesn't have to be inserted very far at all. And now slowly injecting half of the 4% lidocaine that has been calculated at a dose of 3 milligrams per kilogram, explaining to the patient it may be slightly uncomfortable during the injection. And once that's done, we gently come out, and we would then repeat the procedure on the other side.